Standing here with audience member Mr. Edward Jackson. Now, the series as a whole, what did you take away from it?
I was very impressed and appalled the staff and the production crew with how they incorporate just not the message of HIV with information about not using a condom, just the education on HIV. More than that, they talked about the community restraints, the norms in the community, the mental health, the social, the economical issues that are related to the HIV when it comes to the behavior change. And most important, it was talking about the dialogue and communication, which is a very key component of HIV. So we could give them information, resources, and give them tools, but if we don't have the dialogue and the communication, that's another component that will help eradicate the spread of the virus.
Standing here with C. Dwayne Cunningham. Now, you've played multiple roles in this production. Tell us a little bit about how you came here.
It all started, I answered a casting call that Ray sent out about first of the month. And once I got on set, I met Thad and Cedric and Ray, of course. And it was just, we connected. We all connected. My role was only as an extra, but I kind of talk a lot. So as much talking I did, I kind of talked my way into helping out. And then Thad actually offered me a audition piece for editing first of the month. Edited first of the month, went well, and then worked with them on Till Death and some other things. And it's just great to be a part of the team.
Okay, now you clearly have a passion for this.
Yes, ma'am.
What advice would you give to aspiring filmmakers?
There are no such things as small parts. Any part that you can get on any movie set, short film, web series, anything, you should take it. Open to criticism. All it can do is help you. All it can do is make you better.
Okay, thank you so much.
Thank you.
Standing here with Miss Lisa DeSales. Now, you are the production assistant. You are new to the film industry. What were some difficulties that you had with the production connections itself?
Difficulties, I really didn't have any major difficulties with the production, but coming in after the third series, coming into the third connection programming, catching up on and becoming familiar with everything that was going on, and then just the level of professionalism that they have, the accuracy of everything that's stated, being able to be on the level with this production company and fulfill my role and my commitment to them, just being there and doing what I needed to do.
Now, you talk about the professionalism in the series, and because the series is related so close to home and you were able to work with people who knew what they were doing, what do you think the audience can take away from this?
I think that this production is so clear and to the point, and it will hit so many people where they live. I think that it will motivate people to go be tested, if they're not tested already, to talk about and have more open discussions about HIV and AIDS and infidelity and forgiveness and issues that are related to family, marriage, So I think it's gonna be an opening to start a new discussion of HIV in the African American community.
What was it like working with your own sister? You talk about family and how you can relate to what's going on at home. What was it like in your home?
It was a wonderful experience working with my sister, not even realizing the talents that she had, that she brought to this production. I was just in awe. I want to bring that back to my family. I want to tell everybody how much I appreciate what my sister does, how she put our family into the films, how she dug from within. I'm just proud that my sister was a major part of this production.
Standing here with screenwriter and production assistant Rafaela McCrary. Why did you want to tell this story about connections?
Well, because I have a 20-year nursing background and I have 10 years of experience in HIV prevention awareness, I've seen a lot of people become infected with HIV needlessly. And I know that even with all of the prevention information that's available, people are still getting infected, especially here in the South. And I think the reason is that HIV is still such a taboo topic. And I thought that if I could come up with a clever way to get people talking about HIV which I think that we accomplished in doing connections, then maybe somebody would hear something that they hadn't heard before and that they could apply that information to their own sexual behavior and perhaps make some changes to decrease their risk and ultimately decrease the number of cases in our community.
Okay, now after writing the script so close to home, making people where they can relate to it, do you think it will encourage them to go out and get tested versus reading about it on the internet or word of mouth?
Yeah, I think that connections will definitely encourage people to go out and get tested, because what we tried to do in Connections was give people stories that relate to their actual life, things that they see in everyday life. And that if they could see those things and apply those things to their own behavior and say, oh, I've done that, I've been there, I know what that's about, maybe I should go get tested. So hopefully, Connections will definitely encourage people to get tested.
Okay, thank you. Standing here with audience member Veronica Murray. Now, what did you take away from the series?
It was very educational, but the thing that stood out the most to me, I went in kind of thinking, okay, we're going to talk about HIV, but it was deeper than just talking about HIV. It brought out a lot of characters, things that I can actually relate to. I mean, I just thought they did a really good job as far as getting in depth with the characters and making it feel human as opposed to HIV statistic-wise.
Absolutely. So do you think that other viewers will be able to relate to this more than just going on the internet and researching things about HIV?
I really do, because it's not in your face telling you HIV is bad or HIV victim is this. It's giving the viewers a chance to say, to formulate their own opinions. And I really feel like, honestly, that's what's missing. Like in TV, it's so directed, saying this, this, and this. But these series allows you to really sit there and think and find yourself in the actual series.
Absolutely. Thank you so much.
Standing
Here with director Cedric Wary.
Yes.
Now, what do you think was so significant about this film versus any other film that you've done?
Wow. I think what was the significance behind it is the meeting. We're honing in on one particular, if you will, ill in society. And this one is HIV. And what we wanted to do in the Connection series was to connect all different types of ways on the ways that HIV can be spread. But not just the way it's spread in behavior, but who it affects. I have this saying that it's not who we are, but it's what we do that puts us at risk. And certainly when we see High Five, where 5 young girls have contracted HIV through their sexual manners because of substance abuse, or we talk about people in Bloodborne born with the virus and how to try to hide or keep that stigma away from other people. When we look at First of the Month, how people over 50 can contract HIV just like young kids can. It's all about choice and behavior and things of that nature. And finally, the last one, Till Death Do Us Part, a couple, a married couple. But again, everybody is in charge of their own sexual behavior, but what happens when 2 people marry? Then they're both also now, they have to do with one another. And so now we inflame all of these into a manner that people can watch this, because it has all of the elements in it. It has the drama, it has the humor, it has good acting, and it has a great storyline. And it's me and it's you, it's us. And that's what Connections is all about. And if we can use this series as a way to just to get the people to think, because it's 2013 and it's still not illegal to think. And that's the one thing we want to do, is be able to think before. And we think that these films can at least get people to watch, to look, and to think.
Okay, now because Connections is so relatable and people can relate to what goes on in their everyday life, and it's based off real stories and true people,
Yes.
What was so hard for directing this film? Like, was there any difficulties in it for you? Did you have to reach outside of the box and what you would normally do, because it is so close to home?
Yeah, you know what? You're absolutely right. One of the hardest things to do first was to get with the screenplay writer, to say, okay, here's what we're looking at. And then we had to relate it to a storyline, but also make the words, the language, be true to the art of what we're doing in the field of HIV. And then the biggest thing was the pre-production side of things, how we're gonna do it. And then once we bring everybody together, the lingo, and then the emotion that has to evoke from it. So my job was much easier after we yelled action, because everybody was in their set places ready to go to deliver the best product. And I love telling them all the time, this is going to be seen not just in Huntsville or Birmingham or Montgomery, but a small town in Idaho, a small place in Nebraska or wherever else, because kids, people over 50, people that have sex, people that use drugs, all put themselves at risk. And we got to make this thing right, that when people see it, they see themselves.
Absolutely. Now, as a director, you deal with many actors. And since this is more of a true story series and it's not based on, fiction,
Right.
What do you tell the actors, or how do you help them come out and to be honest on camera?
One of the things that I try to do for some is I try to tell them stories of my true life in terms of working with people that are HIV positive, like a 15-year-old young man who just tested positive for HIV and he's afraid to tell his mom, and he don't want to tell anybody to support, to give him the support he needs. He can't just live with this without telling anyone. Or to tell him about a 68-year-old client that we have, or a young female that got infected with the virus because her husband cheated. Sometimes just simply telling the actors these stories before we come together to even rehearse allows them to put themselves in that character, and then to not take for granted the character that you're playing is a real character. It may not be real in the standpoint of someone you know, but you make it to the point that it's relatable to people that are watching it.
Absolutely. Thank you so much.
Thank you.